Well, if you are listening to this episode today, chances are the words low back pain feel all too familiar. You've probably tried massage, you've tried muscle relaxants, maybe even yoga or a chiropractor, and yet your back still hurts. Well, the important thing to know is you are not alone. Lower back pain affects 1 in 4 American adults, and it is the leading cause of disability worldwide. And despite the endless list of remedies out there, most treatments just don't work long term. In fact, a new study looked at hundreds of trials and found that only one treatment consistently showed results. So, what if the problem isn't you or your pain tolerance? What if the issue is that the quick fixes you've been relying on were never the real solution in the first place? Well, today we are joined by Dr. Yash Mehta. He's an interventional spine and sports medicine doctor at VSI, specializing in helping patients finally get real answers and real relief, which is what we're going to talk about today. He's going to break down what actually works for lower back pain, when it's time to stop chasing those hacks, and how to take the first real step toward lasting recovery. We need you, Dr. Mehta. Thank you so much for joining us in this discussion.
Thanks for having me, Laura. Good to see you as always, and thanks for having me here.
Yeah. Well, Dr. Mehta, we have all had that one weird thing that we use to deal with back pain. I hear it a lot from my friends, rolling around on a tennis ball, hanging upside down, whatever it is, maybe bribing a family member for a massage. That's my go-to. What's the strangest thing you've ever heard of among your patient group on what they're doing to kind of solve the lower back pain? Weird things.
Yeah, conveniently, that's my wife's go-to as well. But then obviously when it's my turn, she'll do like the 5 second, be like, all right, I think you're okay. And I'm like, that didn't cut it. I've heard of a couple ones, the inversion table is good or hanging off of a bar. Those are some good ones. I would say maybe the most weirdest one is the ones that my friends have seen me do is kind of when I get on my back and then I throw one leg over another leg on my shoulder and I'm like twisted. I'm not going to get that picture in your head right now. But I'm just in like this weird position and it just feels good for the mid and lower back. And then I can almost get like a little pop and release in there.
Yeah.
But my friends and family that have seen it, they're like, dude, what are you doing? That just looks so weird and uncomfortable, but I swear it works. So
Yeah.
whatever works, right?
Whatever works, and that's what we're talking about and looking
Yeah.
for today as solutions. But I first want to get into like what's really going on when our lower back is experiencing pain. And I understand most cases of low back pain are non-specific, meaning there's no real clear cause. Why is that?
Yeah, I think it's because the back is so intricate, right? And so, if you stub your toe or jam your thumb, that's a localized area of pain and inflammation, and things are pretty localized. And our body is good externally at localizing things, but internally, we're not good at localizing, right? So our internal nociceptors of pain are not good like that. And so I tell people the example of back in the day, if we watched a movie or TV show and the guy has a heart attack and his jaw hurts or his arm hurts, well, it hurts over here. It's not over here. And that's the same pathology or mentality to think about when we're thinking about back pain. You have many muscles that run up and down your back, and you have this whole chain of muscles. And so, if that one muscle is inflamed, it can still spread pain up and down your back or radiate to the sides or sometimes even down the buttock or down the thighs. And so, because of the lack of specificity of where those pain receptors are. And then even when they come into the spinal cord and they go up towards the brain, they can overlap in a couple of levels. And so you can have, let's say, even if you have, not to get too detailed for you, right? But if you have like an L2 injury, that L2 injury can be felt all the way from T12 to L4. And so that's a big area of where you can feel the pain. And that's why it's so non-specific and it's hard for patients. The hardest question I ask patients, which I understand, is can you take one finger and point to where your pain is? And then they take a whole hand and move it in an area because it's not specific, right?
Mhm. I do want to invite our listeners, in case you are listening on the audio version of Get Back to Your Life, we are doing a video portion of this as well. So please feel free to join us on the link in the show notes on YouTube for this discussion. What are the most common triggers for back pain?
That's a great question. So, couple common triggers is just lifting a lot of weight, right? With bad posture. So, if, for example, I have children, I have a 2-year-old and a 4-year-old. So if I have to get down and pick up my daughter and I don't use the best posture, or load some luggage, we're going out of town this weekend, load my luggage into the car, and I reach over like this, reach across my body, and I'm not bringing it close, not using my knees, I'm increasing that lever arm, that force in my back, right? And if you increase the distance, it doubles the weight on your back. If you increase the weight, it doubles the weight on your back. So if you have heavier weight and you're not bringing it close to you, that's 4 times increase of the pressure and the force on your back. And so you're
Mm.
setting yourself up for failure like that. So weight is a thing. Another thing is, we talked about this a little bit ago, in a different avenue, but we're not stretching, we're not getting ourselves ready, we're not as active, so our muscles are not used to moving like this. And if we don't stretch or do a warm up, even if it's something like loading the car or shoveling the snow or mowing the lawn, doing a quick 3 to 5 minute warm up can pay dividends down the road, and it prevent you from that injury.
I talked to, well, you and a few of the doctors at VSI over the winter about shoveling, shoveling snow. And what you're saying about the warm up, I got out there. I've heard it so many times, but I got out there. I didn't want. I'm a very active, athletic person. I got out there, didn't warm up, and I started doing it, and I had lower back pain for about a week because I didn't do that. So I think I certainly underestimated the need for warm ups, which you and the other doctors at VSI are always talking about. So that makes all the sense in the world. But the
Yeah,
question is, go.
sorry, just to interrupt real quick. I think what we're going to talk about something later that you hinted at in your intro. But one thing is, hey, we're all human, right? So I actually talked about the warm ups and then didn't warm up after the first snowfall, and my back was sore for a week, right? So these are things that I talk about with my patients all the time. I talk
Yeah.
about physical therapy, I talk about eating healthy, and then my patients now know I'm in physical therapy because I haven't been diligent with my back. I haven't been listening or practicing what I preach. So we're all human at the end of the day, but it's how can we work together, motivate each other as a community, and take one step at a time to improve our health.
Yeah, and just exactly informing those healthy habits so that we do remember all the time. And so the question is, like, our lower back hurt for a week because we didn't take that 5 minutes to warm up. But what can you tell us about when it's a time to go see the doctor to get medical attention for lower back pain, and the difference between that and whether it's just an annoyance that we can sit through?
That's a great question. And I think that's something, my mom calls me all the time being like, hey, this hurts. Do I need to go see a doctor, or are you the doctor I see? And I'm like, well, let me ask some questions, right? And so it depends on a couple of things. If you have a injury or something that happens kind of without trauma, right? So obviously if you're in a car accident or you lift a weight and you feel a pop and all of a sudden you have numbness, tingling going down your legs, those are things that we call traumatic injuries. If you have trauma, you need to get you need to go see an expert or get some advice earlier on. But if it's more nagging, you wake up one morning, maybe you raked the lawn or you shoveled or things like that, you wake up and your back is kind of sore, listen to your body. If you felt this before and it's something that and hey, if I put an ice pack on it or I take an ibuprofen or something like that, and give it a couple days and allow the natural progression of the disease and the inflammatory response of your body to take over. Our body does wonders, right? As an osteopath, one of my tenets is our body has an ability to heal itself. And I don't care who you talk to, but that has been that has proven itself time and time again with patients, right? Sometimes we try to throw everything in the kitchen sink, and we just need time, right? Time heals all wounds, is there's a reason that's a saying. And so, but give it a couple days, and if it's normal to what you naturally feel, then it's probably going to get better. But now if those couple of days turn into a few weeks and you're not getting better, then is the time to get seen, right? So if you have an ache or a cramp or things like that, most of the times those will get better with time. Give it some time, but
Okay.
still do conservative treatment. But if it's trauma or something's persisting or something just doesn't feel right, again, listen to your body. Your body will tell you if it's time to actually get some more help.
Excellent advice. Okay. So, talking about solutions now, there is a sea of treatments out there, as you know, from painkillers to acupuncture, massage, heat, exercise. There's a new study, though, that looked at hundreds of trials and found that only a handful of treatments actually have solid evidence behind them. So, why, in your opinion, are so many people wasting time and so much money on all these things?
I think it goes back to the first question or second question you asked me about how back pain is non-specific, right? So if I don't know exactly what's going on, um, then I'm like, what do I do? I don't know because I don't know the problem, right? One. Secondly, back pain is a significant problem in people's lives. We were just talking before this. I was talking with our team here and then even a patient about sometimes you have to cancel travel plans or you have to change, you can't go pick up the kids at school anymore because you can't get out of bed because your back is spasming. And now your wife has to leave work halfway through the day because there's an inconvenience, right? So not only is it a mental and physical inconvenience on you, can inconvenience the family, inconvenience your travel plans and things like that. And so when it becomes that pervasive into your everyday life, then you're like, I'm going to try no matter what I can do because if anything gives me some relief, it's worth it, right? Small but different anecdote. If the flu season just ended, they say that if you take like an like the flu medication, it only decreases your day, like it takes away 1 day of recovering from the flu. But the flu
Mm,
is so bad that when you have 3 days of being like having those symptoms, you're like 1 day is better than no days of that, right? And so it's like, I don't care, I'll pay the money to feel better for a day. And
right.
that's kind of similar, right? So if we don't know what's going on and it kind of takes over our lives, then we're going to try anything that's possible.
Yeah.
And
Yeah.
then the second point to that question is I know the studies say that there's only one or two proven things that help, but that doesn't mean these other things aren't working in their own ways. But sometimes we need a kind of like a conglomeration of different things to help different people. The medical textbooks are all the same. Anatomy is meant to be one way, but you're not the same as me or my patient. My first patient that's a new patient for back pain is not the same as the last patient who's a back pain patient. They all have different journeys. So when I talk to my patients all about where are you on your journey, what have you done on your journey and how can we help you facilitate, because it's not a one size fits all. It's almost like everyone needs a custom tailored suit, and how can we tailor that?
Yeah, yeah. That's a very, very good point. It is not one size fits all.
Yeah.
The same study that I referenced did find that NSAIDs like ibuprofen were the most effective for short-term pain relief. Is that's surprising to you?
That's not actually that surprising, right? Well, our first go-to actually recommendation wise, anecdotally, just everyone is anti-inflammatories because they're so powerful, right? A lot of times when you have acute pain or onset, like sudden onset pain, what's happening is your body then has an inflammatory cascade that gets triggered, and then those inflammatory mediators then trigger other things, and then you have more inflammation, and that
Mhm.
inflammation causes pain. And so the goal of the anti-inflammatory medication is kind of almost nipping it in the bud, right? And so if you can, kind of prevent that inflammatory cascade from happening, yes, maybe that insult is there, right? You had some sort of sprain in the ankle or you twisted your back. Yes, you have some injury, but we're preventing the downstream effects of that from happening. So that's not that surprising, actually.
Yeah, inflammation is the evil doer.
Yes, and I think going back to this motif we're building on, right, is are we spending a lot of money? So are you buying? I have patients that are like, "Hey doc, I have this anti-inflammatory." I just had a patient like 2 3 weeks ago. They gave me this medication, and they're like, "What do you think about this?" And I saw, and it had like so ginger, turmeric, garlic. These are all great natural anti-inflammatories. I tell my patients to take. And so my first question was, how much are you paying for this? And they were like, well, it's $45 for a 30 pill bottle. And I was like, this is going to be great for you, but you can just take like a teaspoon of all this every day at home and probably save so much money, right? So
Mm,
I think to go back to what we're talking about, it's not that some things are not the best for you or they're not going to help you, but how much relief are you going to get from each thing? And then how much financially, time wise, how much effort do we have, right? We all have limited hours in the day, limited money in the bank account. So we have to maximize our health and our efficiency and whatever resources we have. right? And so doesn't mean you can't do all these things, but how can you optimize your health and do what's best for your body without breaking the bank or things like that?
Well, one thing that doesn't cost any money is exercising, moving around, and that is showing some benefits for chronic pain. Not, it's a small margin, but it's something. Why talk about why movement is so important?
Movement is just key, right? If we can keep moving, we're obviously putting that straight stress on our body. Dr. Schuler, who started VSI, always said movement is mobility, movement is life, and then you're
Mm,
lubricating the joints. So you're keeping it's a well-oiled machine, right? In a factory, there's machines and you got to oil them. The more you're moving, you're oiling your body, you're getting good circulation. So the muscles are being used, and they're not used to not having to work, right? I often give my patients the analogy of a team at work or a family at home. Let's say there's a family, right? There's me, my wife, and my two kids. And if my wife has to do all the work, all the time, all the chores, us three get kind of lazy. We're not used to doing the work, and she gets overworked, over fatigued, overburdened, and tired. And
mhm.
our body's the same. So if we're only using some of the big muscles all the time, then those muscles get tired, fatigued, and have some chronic pain. And so the goal is to do some of these stretches and exercises and work on some of these smaller muscles. Going back to the back has about 6 to 10 different muscles that are layered very intricately in our back. And if we're only working out the big muscles, as most of us do, then the smaller muscles get lazy. They don't have to work as much. And so then when the time comes that they have to actually then show up on the project, right? You have that project, if you remember back in middle school, maybe one or two people did it, some people didn't do the project, but then the teacher calls on you and they're like, oh, well, Yash, you've been quiet for a while. What do you have to say about this? And like, I don't know. You freeze in the moment, and your body can freeze in the moment, right? Your body doesn't know how to react and get going. And so that's what can really set you up for being in pain.
Well, and speaking of movement and exercise, what about yoga poses? There is research that shows that there are benefits of yoga and for lower back pain. So, what's your take on that? Can that be too much for some people?
Again, the biggest thing is always listen to your body. So yoga unequivocally has health benefits. Not only is it good as a physical practice instead of in terms of stretching and exercising and being more limber, but it's meant to also be like a meditative practice, right? And so that's something I've been bad about historically, but recently over the last few weeks have started doing sun salutations in the morning again. And I firsthand have also noticed the experience of just taking 5 minutes to stretch out. During the day, I just feel less sore, less tight. I don't feel as much pain in my hips and my knees and my low back as I usually used to do. And so I think it's a great practice to try to just do a low intensity stretch if you do a few poses. But again, listen to your body, right? So one of my patients, she was like, hey, when I go to yoga, it's really good, but then there's these couple exercises that I just can't twist like that or can't bend like that. I'm like, okay, then take those to do another pose or things like that, right? You don't want to overdo something or push yourself too much. Now, a question I often get from patients is, well, how do I know if it's pushing myself through the pain versus pushing myself too much?
Mm,
And I say, well, if it's a little uncomfortable, but you can still do it, then push yourself. You're pushing yourself a little bit through the pain. But if you push yourself in that moment and then you can't like come out of the pose or you're sore for a week, that means you pushed yourself too much.
yeah.
So that's kind of the fine line and it's hard. But again, the biggest thing is listen to your body because your body will tell you.
hmm I want to ask you about a couple of other potential solutions too, including spinal manipulation, like seeing a chiropractor for adjustments, and back taping. Those also made the list as hacks people are using. Who benefits most from those treatments?
Yeah, that's a great question. So, working backwards, back taping, K tape, postural tape, that's all good. Because if people have bad posture, it's basically just to be like kind of biofeedback, right? So if you tape in an ideal way, and then you kind of don't are not in that position anymore, the tape stretches or you feel some stretch receptor, and then you kind of know it's biofeedback. There's also something called like upright go. There was like a big device that was popular about 5 years ago that you tape on between your back. And if you're not in an upright position, it's basically like a level, electric level, and it would send a small jolt into your body. And so, hey, I'm not upright. But again, to our original question, how much time and effort are we investing in this, right?
Mhm.
Taping is expensive and you can't do it yourself. So you need a licensed professional to tape you in the proper way. Otherwise, you're just taping yourself for fun. And so you've kind of wasted the money. And so it's effective, but in the right patients. And to your question, usually the right patients for things like that are athletes because it helps them play through the injury, gives them the biofeedback to not overdo it, but keeps them competitive, right? For us average Joes, taping is probably not as effective or not any more effective than just stretching and being active and things like that.
Mhm.
And in terms of manipulation, chiropractors and stuff, hey, chiropractors are good, physical therapists are good, manipulations are good, but when in the right patient, right? So just
Mhm.
giving yourself a high thrust and cracking, not the best for everyone. May not be the best for patients that have pregnancy, osteoporosis, rheumatoid arthritis, these types of diseases that put your bones at higher risk of fracture or put our bodies at higher risk of breaking down. Then you don't want to do those high velocity movements. Then the Tai Chis, the yogas, the walking on a treadmill, just some of these low impact exercises, even aquatic treadmills, those are much better, right, for our bodies.
Mhm. Okay.
So
Um,
just everyone's not the same. And
yeah,
we have
yeah.
to really be mindful of that.
Yeah, and listen to your body, as you've said a million times here, which is so true. And sometimes we just don't, and so it's a good reminder. Let me ask you about one more solution. And you had a great TikTok about heat and ice, when to use heat, when to use ice, and massage too. Can you talk about how heat, massage, ice, they don't have strong scientific backing, but many people swear by them, and they can provide some relief. In my experience. So, should we ignore treatments that don't have clear evidence, or what's your advice on that?
Again, listen to your body, and sometimes it's just whatever works for you, right? Heat or ice are not proven long term to have any more significant impact than something else. The biggest impact you can have on your body is just continue moving, strengthen your muscles, your core, eating a well balanced anti-inflammatory diet, right? Unfortunately, we live in an instant gratification society. So
Mm,
if a patient comes to me, they're like, "Doc, I've been in pain." I'm like, "Great, let's do some physical therapy. Let's change your diet." They're like, "That's not why I came to you. Like, I want a medication. I want an injection. I want to get out of here. I need to get back on the golf course on Saturday. It's Wednesday. That's why I'm coming to you today." What do you mean, like, go see a physical therapist and change my diet? Right. And so, unfortunately, society has just programmed us. I need something. I get online. I order it on Amazon. It gets there in 2 days. And we've become accustomed to quick fixes for solution problems. And our body, our health is not a quick fix, right? And so ice and heat can be used if it's working for you. And it kind of just depends. In general, if it's an acute injury, then ice is going to help. Again, kind of works like an anti-inflammatory. It calms things down. It causes vasoconstriction, so you're not getting as much blood flow to the area. And so it helps with pain. But if you have chronic pain or more muscular pain, a lot of times, I know females also around their cycles, right? Like cramping and things like that. So muscular pain, chronic pain, if your shoulder's hurting, heat helps because you're actually loosening the musculature and you're preventing blood flow there. So then you bring some of these mediators that help the inflammation, help with some of the rejuvenation.
okay. And, so many people have listening right now have probably tried so many of these different treatments and spent years trying something without lasting relief. Let's talk about how we can prevent it from happening in the first place. You addressed, when's time to see the doctor.
Yeah.
But when how do we know how to prevent this? What
Yeah.
does prevention actually look like?
That's a great question. And again, you're not the only one for the people out there. I've tried anti-inflammatories. I've tried a muscle relaxer. I've tried postural tape. I've tried massage, heat, ice, everything for my various ailments over time. And how do we prevent this? Unfortunately, what I've learned, right? I'm kind of young. I'm 34, almost 35. So I'm on the younger spectrum, but I'm older than some of these 20-year-olds, 18-year-olds that I see in my clinic or that I play sports with. And so what I've realized, and it's taken me, unfortunately, this long to realize, is sometimes it's not going to be the quick fix. And so how can we prevention is key, right? There's this whole big focus in the medical field called preventative medicine. And so that's how can we prevent getting to that place in the first place? How can we prevent getting there? And so
Mhm.
those are the things of like keeping active, exercising, working out our muscles, having a good balanced diet, not eating too much sugar or processed foods, which is my go-to. Reaching for the dessert or reaching for the candy. That's what I used to do for all this time. And I realized, hey, that's not really helping me. And so prevention, sometimes we think, okay, if I have if I put this tape on, or if I take this medication, or if I go get a massage, that's preventative medicine. Not really, right? Preventative medicine is, well, how can I make daily lifestyle changes? Is it an ergonomic chair? Is it better positioning of my back and my neck? Right? Is it eating better? Is it more regular exercise? And we don't have to have a gym membership or things like that, but just getting out and walking, going for a jog, doing body weight exercises and stretches. Am I doing that on a regular basis 2 to 3 times a week so that my body is in the best shape? And so that doesn't mean I'm not going to have an injury. Everyone can have a freak accident or injure themselves shoveling, but then we're giving ourselves the best chance of a quick recovery without having a delayed, drawn out process.
Mm-hmm. And you just talked about the walking. I know a lot of your doctors there and other staff at VSI have walking pads, which I was inspired to get one too. How helpful is walking and hydration? I always have my water bottle right here.
That's
How important is all of that in? And you just mentioned the movement, but like a walking pad, is that okay for your back? Like if you're having back pain, get up and start walking on the walking pad.
Yeah, again, of course, listen to your body.
Yeah.
The first thing, always listen to your body. But second thing is movement is key. You are not going to do anything just by walking, right? That's something we've done for ages. You're not going to do necessarily something just by walking that is going to significantly impact your health in a negative way, right? And so if you can just get up and move, that's the best thing. And when we're talking about how to best allocate our resources, we got our walking pad at home for $99. So
Mm-hmm.
$100 in the grand scheme of things, and the money we're spending, right? If you're spending $45 a month on herbal supplements that you can just buy at Costco and then spend $45 for a year, $100 for something is a big deal. I'm not saying that $100 is nothing. So I get that. But $100 in the grand scheme of what we do, if maybe not buy coffee for 20 days throughout a whole year and not just in a month, now you have the money for a walking pad. If that's going to pay dividends in your health, get up and go, get up and get out there and walk. Um, there's a couple things, right? You're burning calorie. It's better for your health in terms of nutrition, but it's better for your body to just stay active. And
Mm-hmm.
again, listen to your body. If you get up and start doing things and you're like, hey, I'm having weakness in my leg or numbness and tingling or just a sharp pain, then that's when you go see a medical professional, right? That's not normal. But if you have chronic, a lot of my patients say, okay, so I have this L4-5 disc bulge or I have a small herniation. Can I walk? Can I do yoga? Can I do physical therapy? I'm like, a lot of these chronic things didn't happen over time. So you doing your daily activities is tolerated by your body. You're not going to deteriorate your health. If
Mm-hmm.
anything, we kind of get pigeonholed, and historically medicine said, shut it down, don't do anything till you get better. But we need our body to be getting that blood circulating. We need to be moving. If we shut down, then we're actually doing ourselves a disservice and having an increased chance of further injury down the road.
And we're talking about all these physical elements, but I've got to think that stress plays a role in this too. What's your take on that?
Yeah, mental health is huge, and stress correlates directly, right? Obviously, uh, the biggest indicator of, or the biggest manifestation that we know is neck pain, shoulder pain, headaches, because our stress is in our head, and then these muscles here tighten up. But like I said, we have some muscles, and it's a chain that kind of travel up and down. So some of our neck muscles travel up to the upper part of our mid back, then our mid back muscles cover the mid and lower back. The traps are these huge muscles that cover like a big part of the back. And so you can have these referred pain patterns where my
Mhm.
pain is like coming from this area, but it radiates all around here or things like that. So stress can have all these other you know manifestations that we don't think of, right? For me, for example, when I'm stressed, I have TMJ problems. So I
Mhm.
notice I grind my teeth a lot, or I clench my teeth, so then my jaw hurts, but then I have headaches. And a lot of times I'll wake up in the morning with a headache and I'm like, oh, I must have been grinding my teeth. And then I think about what was happening yesterday and I was like, oh, I was a little stressed. I must have been, really, that was manifesting physically in my body.
Mhm.
overnight, and then now in the morning I'm kind of suffering. And that's, you kind of mentioned it earlier, Laura, right? Of, I think that's the trick or the problem with some of these studies, or when the studies say, hey, only one thing has been found to be effective. It's when someone comes to see a doctor, again, instant gratification, we're kind of treating the cause, right? So in the morning, I have a headache, I take a Tylenol, I got better. But if I'm not, okay, what happened overnight? I was stressed yesterday. Why was I stressed? Was it an argument with my spouse? Was it something at work? If I don't try to solve that, well, now I'm going to have stress today. And then I'm going to wake up with the same problem tomorrow. Same thing if we're going, when patients come to me, a lot of my questions are more lifestyle. What is your lifestyle? What is your ergonomic setup? What is your diet, exercise like? Because if we can try to get to the root of this, again, as an osteopath, right? The body and the mind are all connected, is one
Mhm.
philosophy, and the body has an ability to heal itself. But if we're not getting to the root and we're just bandaging the problems, well, that's good, but the problem is still there. If we're not fixing the problem, then we're not really helping the patient, and then that's why these other solutions are not effective, because they're meant to be more temporary. They're not, we're not changing, we're not making lifestyle changes, or we're not addressing the root of the problem.
Yeah, and then it doesn't go away.
Yeah.
Before we wrap, I want to get some final takeaways from you. If you could give three pieces of advice to someone who's dealing with chronic back pain, what would those three pieces of advice be?
Yeah. So the first one would be, don't be afraid to move, right? So movement is health, and but movement is tolerated. So we say don't ignore your pain. So you don't want to ignore your pain, but also don't let your pain restrict you in what you can do. And so movement is okay.
Okay.
Temporary fixes sometimes do help, right? Taking anti-inflammatories for a couple of days, or ice or heat or whatever you need to do, but don't start becoming reliant on temporary
Mhm.
fixes, right? It's sometimes, this is, our health is a marathon, it's not a sprint. And so if you do some of these quick things right away and then you get better for a couple of days and don't get, then all of a sudden you're not better again, it's because you stopped, right? When we talk about weight loss, Ozempic's going to help you get, lose a lot of weight, but then if you don't make lifestyle changes, you're going to gain all that weight if you don't take this medication the rest of your life, right? So
Mhm.
these quick fixes, unless you're going to do them the rest of your life, which is probably not practical and very costly, then we shouldn't rely on quick fixes. And then the third thing is, obviously, again, in terms of listening to your body, which, like you said, I've said a million times, if it's been a couple days or a couple weeks and things are just not getting better, or if you feel like it's different, right? This is not my normal back pain. I've shoveled before, I've had an ache before, but this is different. Then don't wait too long to get help, because it could be something more serious, or you might just need someone to, guide you in a better direction of how to
Mhm.
take better control of your health.
And I'm sure you've seen so many patients who are stuck for years and, who come to you looking for help. And I think you need to do, based on what you're telling me, if I'm hearing you right, you got to do some investigation, and that's where you come in.
Yeah, and unfortunately, I see that a lot with patients, right? Patients come in and they're like, "Well, nobody asked me about." Like, they're like, "Well, yeah, I do sleep like
Mm.
this," or "Yeah, this is how I sit at work," or "This is where my desk is," and then their setup is like this. And I don't know if you can see me here, but like their shoulders are all really high, their neck's flex forward, and I'm like, "Well, yeah, that's why you have a lot of shoulder and neck pain. Like, that's a really bad ergonomic setup."
Yeah.
And so that's going to happen. Or you ask them, "Well, how long did you exercise it?" Because a lot of questions I ask is, did you do physical therapy? Did you exercise? And the question is yes. And a lot of times in the medical profession, because of the speed with which we have to move, then you move on. You're like, oh, they tried it, didn't work. Let's do an injection. Let's do surgery. At VSI, because we have the time to spend more time with our patients, one of the things we do is we ask a secondary question. So when they say they've exercised or they've seen PT, I say, well, for how long? And do you still do it at home? And I would say about 50,
Mhm.
60% of the time, the patient's response is, I went twice, and no, I don't do it at home. And so I
Mhm.
say, well, hey, this problem didn't happen overnight, right? If you have chronic pain, it's not going to get better overnight. So again, instant gratification, quick fixes. But if you have pain and you go for therapy twice and you haven't made those adjustments at home, do you think you're going to get better, right? If in someone else's field, right? If it was engineering or something like that, and it's like, I went into the room, the light wasn't working, so I flipped the switch, and then I was like, oh, the light doesn't work. Or it's like, well, did you plug it into a different outlet? Did you see, is there something wrong with the outlet? Did you try another switch? Because there's three switches. So like, if you just do one simple thing and it doesn't work and you leave it at that, that's not a good solution, right?
Yeah. Well, that's a great analogy. It's perfect analogy. And I just your final takeaways: don't ignore it. Don't rely on temporary fixes, and don't wait to get evaluated if something's been bothering you for some time. Important to get
Exactly.
those
Listen to your
answers.
body. Yep.
Yeah. Listen to your body. We'll leave it there. Dr. Yash Mehta, Interventional Spine and Sports Medicine doctor at VSI, specializing in helping patients get final real answers. So we really appreciate your insight on this today. Thank
Thanks
you.
for having me, Laura. Good to see you as always.
You
Take care.
too. Thanks.